Hi doctor, how are you doing?
I'm fine. How are you?
I'm doing fine. My grandparent actually had a heart disease.
Okay.
And he's not anymore. Someone in my family had a heart disease. Am I also expecting something similar? Is it hereditary?
There is a strong hereditary component in the coronary disease. If your parents, male person less than 45 years of age or a woman less than 55 years of age, you have a strong suspicion, there is a possibility that you may have a early coronary disease. So you have to stratify the risk and go for a periodical checkup to rule out.
If we generally look at it, it's not always hereditary, right?
Yes. Always.
So what are the kind of heart diseases that are usually passed on, from generation to generation?
See, there are a lot of familial hypercholesteremia. The family has high levels of cholesterol. Incidence of coronary disease in the offspring is increased by 20% times. And like hypertrophic cardiomyopathy, there is a genetic component. So these are when the person has the chance of that passing on to the offsprings are very high.
When you say this, you mean that whenever a person is coming for any kind of heart disease, they always need to go and check the family history? It's a mandatory thing?
If it is a case of young patient, male of less than 45 degree, strong family history, I would investigate completely to rule out.
Oh, okay.
So every year I screen them to see whether they are prone for heart problem or not. Or earlier if I have any symptoms of breathlessness, chest pain, so I tell them when they come to me counsel, these are symptoms, you have to monitor it. If any time you have this symptom, please go to the nearest hospital to get evaluated. Rather than waiting to you go to your own doctor, you should go to the nearest hospital.
And it should be a cardiologist, as you say.
Even a general physician can help you at the point of contact. Okay. And if you go to the cardiologist, that is good enough.
Okay, but let's say I don't have any issues, but my dad has one. Should I be under some sort of a scrutinification or something like that? Or
yes, every year if your dad had a heart attack at the age of less than 45, then there is a strong family history passing on to you.
Oh, okay.
So you should have a periodical once in a year to see your lipid profile is fine or not, whether you are a pre-diabetic or a diabetic, other risk factors. So these things which cannot change. So the things which can change is lifestyle modification. Right. Your lifestyle will help you to slow down the process.
I have a bigger question over here now. When you say lifestyle modification and all, I am completely okay as of today. So there are some sort of food restrictions that I should go ahead with?
See, it's like prevention. So we don't treat only after the disease happens. The most coronary disease is a preventable disorder. So rather than treating a person after getting disease makes no sense. So prevention is always better. So when you have a strong family history, it is always better you try to increase your lifestyle. One is exercise. Eat healthy food. Eat more of leafy vegetables, fruits, less of junk foods. Once in a while, it's fine. Avoid too much of fried foods. So that is why now the reason for having incidence of heart attack, lack of exercises. If you see for eating junk food, this leads to increased coronary disease. This, if you can correct it, the chances of having a heart problem is less likely. But you can't prevent 100%, but you can always...
We can try to minimize it as much as
minimize
possible.
That possible.
Okay. So considering all this in mind, is there any kind of specific genetic conditions also that we are looking at that people should be aware about?
Yes. For example, if you are family had a strong family history of heart problem, so we look into the cholesterol levels, homocysteine levels, protein C and S, and we see other conditions like obesity, other genetic conditions like hypertrophic cardiomyopathy. So these are the common conditions we look into it. If there are a lot of hundreds of genes are there, so these are the common genes which will look into it to prevent.